Hello, my name is Michelle Moser. I'm a clinical liaison for Revelation Pharma, and today we're going to talk about compounding for dental issues. So the medications that I'm going to talk about are not evaluated by the FDA. These products and preparations are not intended to diagnose, treat, cure, or prevent any disease. This webinar is for informational purposes only. Medical advice should be sought at the discretion of your medical provider. Compounded medications are not evaluated by the FDA. So I want to start off with, let's talk about medications that enhance patient needs. I think that that's really important. What medications can be used for even autoimmune issues, as well as what dosage forms are available for compounding of dental preparations. And how can a dental office obtain medications for office use? So numbing agents. I think that those are really important to be used because sometimes that's just very painful in the mouth. And we need to make sure that everything is, numbed and people are quite happy with what's going on. So diclonine is a product, just a 1% solution that can be flavored, and it really does help to numb the surface tissues. So it's not a real deep numbing agent, but it does help, especially with gag reflex and some of the, even when you're doing some cleaning procedures. Now, it can cause some coughing, primarily because if it does numb the back of the throat or if somebody swallows it, it can kind of trigger a little bit of a coughing effect. And it can be ordered by a 503B outsourcing facility. The 3-cane preparation is usually a thick gel. It's LPT, which is lidocaine, prilocaine, and tetracaine. Like I said, it's kind of a thick gel. It can be supplied in a small syringe with a long curved tip so that it can be applied directly to the gum line. So if somebody's needing to do a deep cleaning, that can help numb the agent so it's a little bit more pleasant for the patient. It can also be applied with a long Q-tip to any injection sites so that when the needle is actually put in, it doesn't hurt. I mean, there's still some pressure that's felt, but there's not necessarily any pain. We do need to make sure that the gel is rinsed off before 2 minutes to avoid any sloughing of the tissues. Very important. And at one point in time, we were actually adding some phenylephrine to this preparation to help decrease any bleeding. But what we find is that the LPT in the 10-10-4% is quite sufficient. So antiviral agents, again, are very popular, especially with the oral cavity. It's not uncommon, especially if people are going up skiing, that they're exposed to a little bit higher sunlight. And with that, sometimes herpetic lesions can pop out. Well, acyclovir 5% is commercially available in an ointment and a cream. So the FDA does not allow us to compound essential copies of commercially available preparations. But if we add lidocaine 1%, we're actually going to numb the area as well as help decrease that viral load. So what's really nice is that often acyclovir is commercially available and very expensive. Even if it's covered by insurance, in generic, it can still be very expensive. But we can compound in a lip balm, a lip ointment, or an oral mucoadhesive paste. All of this does require prescription, and that way we can keep the medication exactly where it needs to go. It's usually applied anywhere from 2 to 5 times per day. Now, medications for oral or for autoimmune issues, I bring that up because a lot of times when people present with an autoimmune issue like lichen sclerosis in the mouth, that's actually because there's other autoimmune issues going on in the body. And we all know that the mouth is very easily connected to the gut. So any transference of the oral biome can be moved to the gut, which can also affect other areas. So low-dose naltrexone is a medication. So naltrexone was FDA approved in 1964 at a 50 to 100 milligram dose, primarily for alcohol overuse syndrome and methadone syndrome. However, since 1985, so 40 years now, we've been looking at this in very small doses. So Dr. Bahari, Dr. Zygon, Dr. Younger have been very thoroughly studying this medication. And currently, there's over 900 published papers and case studies available on various medical conditions with the use of low-dose naltrexone. So how it works, low-dose naltrexone works to reduce cytokine production, those cytokines that are pro-inflammatory, so interleukin 6, 10, 12, that sort of thing. It also helps to modulate the immune system by upregulating the endorphin receptor sites, but it will block toll-like receptors, so specifically 4, 9, 10. 4 is very important when we're taking a look at immune system, but also when we're trying to evaluate how disease states actually cause illness in the body. But toll-like receptor 9 is more of a surface issue, and that really helps with itching and irritation. So a lot of times people will talk about kind of a tingling or a burning or an irritation. That's toll-like receptor 9. But it also will block opiate receptors, the same receptors that morphine and tramadol and hydrocodone will block. But it also blocks the opiate growth factor receptors. Those are involved with cancer production. So we have literally seen on PET scan, on a wide variety of other imaging, the reduction of tumor size with the use of low-dose naltrexone in an oral form. Doses are very individualized. So we might start at a low dose and slowly increase that dose over time. But what we find is that some people do really, really well at 1.5, 2 milligrams, and others may actually have to increase 4.5 milligrams, maybe even up to 6 milligrams or 9 milligrams. So that can be kind of hard to track, but at the same time, that's where your compounding pharmacy is going to be very helpful in guiding that patient with finding their happy dose. So like I said, there's over 900 published papers and case studies available on various medical conditions. But what we've also found is that low-dose naltrexone is primarily used orally or transdermally so that the medication can be systemically absorbed. So it literally can be delivered to a wide variety of cells throughout the entire body. When we're using a topical product in a cream or a gel, that's primarily going to be just for that site. And it doesn't necessarily replace an oral or a transdermal medication. Mainly because even though we might be dealing with something in the mouth, there's probably more issue elsewhere in the body. So I wanted to bring up this article because I think it's very helpful, especially for dentists when they're dealing with patients that have multiple medical issues. But this is something that I have handed out hundreds of times to a wide variety of medical professionals that are looking for kind of a summary on how low-dose naltrexone has been working in a variety of disease states. So I call this the Dartmouth study, mainly because it was a few people from Dartmouth University that compiled this paper back in 2017. So what they did is they took all the articles that were available up until that time, and they categorized them by disease state. Then they summarized how this study was put together, the doses that were used, the summary of that study, and the patient outcomes associated with that. So it's a very easy to read, very succinct. And since 2017, we've seen numerous other publications come out, even as late as December of 23. We have seen additional science being conducted on low-dose naltrexone. I'm often asked about burning mouth syndrome. So sometimes we'll actually make a magic mouthwash, even for radiation treatments and things like that, which usually contain like diphenhydramine, some antacid, maybe even some lidocaine. We can put nystatin in there, other anti-infectives as well. But burning mouth syndrome is one of the neurological conditions that's pretty tough to treat. So in the past, we've used capsaicin candy or rinse to help kind of numb the area. And what it is That's a derivative of a hot pepper, and it literally gets so hot that the nerve endings just stop signaling. So it decreases the irritation and the agitation of those nerves. We also see dexamethasone used quite a bit as a steroid to help reduce the inflammation of that area. And it's simply rinsed with about 1 teaspoon or 5 mils for about 30 seconds, and that can be done up to twice a day. Got to be very careful that steroids can potentiate fungal overgrowth, both in the oral cavity and further down the digestive system. But this is where, again, we can use low dose naltrexone. So I wanted to bring up a case study that I thought was very helpful. It's been used as kind of a baseline for several other opportunities. So this citation was literally a woman in her 70s who was diagnosed with IBS, fibromyalgia, peripheral neuropathy, low functioning thyroid, anxiety, and depression. She had been at an outpatient clinic for the treatment of burning mouth syndrome. She had been diagnosed with burning mouth syndrome and was fairly resistant to multiple treatment opportunities for over 10 years. However, when she was started on a 1.5 milligram, given that dose for 2 weeks, then increased to 3 milligram for 2 weeks, and then moved up to 4.5 milligram, after 8 weeks, she noted a 50% reduction in her sensitivity and severity of pain associated with her burning mouth syndrome. But she also noted that she had a 75% reduction in her other symptoms. It was also noted that after a period of time, she actually lowered her dose to 3 milligrams, and she found even better results following that reduction in dose. So here again is where somebody comes in for a dental issue, but they have a variety of other medical issues that LDN can actually be very helpful with. So because people have more than just dental issues, they have a wide variety of other medical conditions such as cardiovascular disease, wide variety of elevated cholesterol, low functioning thyroid. They may have obesity, they may have diabetes, all of these other situations. So they are on a wide variety of medications. A lot of times they are on a blood thinner, whether it's warfarin or Eliquis or enoxaparin. It could be a wide variety of issues. But when you need to do an extraction or an area that maybe you need to cut the gum or there's going to be some other issues, you're going to have a lot of bleeding. So compounding pharmacies can prepare tranexamic acid in a 4.8% solution. Now, this solution doesn't have much of a flavor at all, and you don't really see any need for sweetening either. I mean, it literally doesn't have a scent. It's just a clear solution. So you can wet some gauze, roll it up, use it with pressure to help decrease the bleeding, and that can be used up to 3 times a day. Now, we've also seen the issue of ferric subsulfate gel and solutions. The gel, we usually throw a little bit of grape flavor in there. It's fairly thin, so it can be applied directly to the surgical site. But we do need to proceed with caution because it can cause some issues where you could see some necrosis if you weren't careful. And that happens with the solution as well. We also see the use of anti-infectives and cleansers. So the most popular and also commercially available is chlorhexidine. But an oral rinse can be compounded without alcohol, and then we can add a flavor. So there's less metallic flavor in the mouth. We can also use a wide variety of anti-infectives like metronidazole or antibiotics such as doxycycline, and we can make those into dental paste that can be applied to areas such as during a root canal. Or we can combine a variety of antibiotics to help with that need for decreasing the bacterial load associated with a decaying tooth. We could even add some anti-inflammatories and some antifungals to that as well. So when I noted that the fluconazole 30% in the EDTA in a rinse capsule, That is literally a dry powder capsule. So medications are added to a capsule that will be opened up and sprinkled into some solution and then put in the mouth, rinsed around, and then expectorated. And here are the citations that go along with that. When we're dealing with really soft tissues in the mouth, it's also really wet and it's very hard to dry and keep it dry. So we can add active ingredients to powders that when they are applied to wet surfaces, they actually form kind of a film or an oral mucosal bandage. And that will allow the medication to stick to that surface for a longer period of time. There are some gels that are available to help keep medications closer to a mucosal tissue so that, again, you can sometimes reduce the dose or remain the dose the same, and then make sure that it is much more effective by using a mucoadherent property. We can always add flavors for palatability. And there is a new film coming out that is a dry powder wafer that can be literally just applied to the surface, and you can also direct the active ingredients to that area. So I wanted to thank you very much for joining me today. This is how you can get a hold of me. This is my email address and my personal cell phone. And these are the networks of pharmacies that I am currently working with. And I hope to see you again. Watch for our next seminar, which will be coming up very soon. Thanks so very much. Take care.